The HiQ work had different components of the work and the methods to try and understand and unpack the problem and the solution. And the reason for that is to say nursing is an investment. You don't only get, extra hands on the ground. You get much more than you probably are conceptualizing. You get a much more happier workforce. You get more satisfied, happier patients and mothers and babies. You get better care outcomes. You get more care being delivered. So it's pretty much to make that argument that the return on the dollar is way more than just what we are measuring. And that helps people see things almost, for lack of a better word, in a 360-degree perspective.
Neonatal care, which is good for the baby, which is going to give us good outcomes, will depend mostly with the care that baby is getting, and mostly starts with the professional care the baby is able to get. That means, is there qualified doctors who are able to see that baby? Are there qualified nurses who have time to be able to take care of that baby? And then do we have the right equipment to be able to take care of that baby? Because remember, these are newborns. They come with different needs. Some are struggling to breathe. Some have jaundice. Some have infections. They need to get the care they need. And when I say it's good, it means if my baby did not come with infection, then they should not pick it in the unit. So you make sure you're not doing any harm. When they are getting the services they are getting from the unit, they're also not picking up more information from there.
We actually saw some of the infection prevention and control improve after the introduction of the ward assistants in these units. And so this included cleaning the equipment, or definitely with the assistance of the nurse, because the intervention was to assist some of the tasks that nurses do. Talking to the mothers around hand hygiene and orientating the mothers to where the hand hygiene stations are located in the units. Cleaning of the feeding cups and some of the reusable items that are used in the units, and also just general cleanliness of the unit.
Some improvements that needs to be done. We need to be hired for more nurses to give specialized care to the units. Supplies need to be supplied in time, because they have to be used to take care of the units. Then staff motivation. We lack staff motivation. Most of us are not motivated because of the shortage, and you have to work long hours sometimes.
My recommendations are in newborn unit, just to work on the challenges, is to hire the neonatal nurses. Having specialized nurses that have been trained on the neonatal care can really improve the care of the baby. Yes, because they can prioritize, they have the skill, they have the knowledge, they have everything that concerns that baby.
To address the issues of dignity and communication within the newborn units, what we've tried to do is sort of build a communication and management training targeted at the newborn unit nurses. So what we've tried to do is feedback some of the findings from the mother's perspectives into that communication training. So at the introduction, or the first phase of that study, is just to sort of create awareness that for mothers, these are the realities when they end up in the newborn unit. These are the worries, these are the concerns that they have. So as a healthcare provider, you might think that they're not listening to you, but that issues on the background, issues on the back end that sort of contributing to what they're doing or how they're acting when they're in the newborn unit. So just raising awareness that as healthcare providers, acknowledge that the mothers are undergoing through a lot of pressure, and think through how can we better support them.
We have undergone, I think all the staffs were there. We did a communication skills training. Now we are able to cope with the problems they are facing because of that training after the communication.
So beyond improving the clinical workforce, and it's important that also the environment and the infrastructure is looked at so that we can also help us improve care. And among those ones is to see that where the newborn unit is located is very close to the labor ward and also the postnatal ward. This will allow for easy transfer of the babies from the labor ward to the newborn unit, and the ease of the mothers to move from their wards to the newborn unit to be able to take care of the baby. Again, also how the grooming for the mothers is done so that they are dressed in a very decent way so that they don't feel exposed and their dignity is preserved as they come take care of the baby. And again, as they enter the unit, they get the briefing so that they know what to do in the unit, because it's also a new environment for them, so that we can also maintain the IPC.
So we have to recognize that we need both people and skill mates. We need numbers and skill mates. And we appreciate that it's a huge toll to move from 1 to 41 to 30 to 1 to 4, which is the WHO recommendation. But I think we need to start somewhere. We need to create a roadmap that says, and work with government to say, what is reasonable within our fiscal space. Is it trying to move towards to 1 to 20, then to 1 to 15 in the next 5 years, then 1 to 12 in another 3 years. So those are the sort of conversations we need to have. We're not saying we should move everyone to 1 to 4. It would be great if it's possible. We recognize we have financial challenges. The fiscal space is very constrained, but we need to start as early as yesterday to move in that right direction.
So the HiQ research outcomes have been an eye-opener for us at the Ministry of Health. This is because we aim to reduce our newborn mortality rates and ensure that every newborn survives and thrives. With the interventions that have been recommended, we at the Ministry of Health are willing to collaborate, incorporate trainings that will be for the betterment of the newborn, people working in the newborn unit, and ensuring that the numbers, we cannot still be having 92 newborn dying every day. We believe that we can get to even less than 30 in the 4 years that we have before the 2030 goal. So it is our plea to everyone. You are an advocate when it comes to newborn health. These are people who cannot speak for themselves. So let's all be advocates in the fight to reduce our newborn mortality as a country.